Good day. I am tasked to discuss and give practical tips on how to deliver oral and poster presentations. At the end of the session, the students shall be able to discuss the general pointers when presenting research, either in oral or poster format in a formal scientific session or conference, and develop the appropriate attitude towards epidemiologic investigation to cultivate a culture of research, including possible practical research-related endeavors. This is the general concept of what we used to refer to as the five-star physician. Being doctors, we maintain different roles and responsibilities in society, one of which is that of being a researcher. As lifelong learners, we are tasked to be updated with regard to new diagnostic tests, development of new therapeutic agents. So research will always be part of our practice as doctors. Whether we are the doers of research or the end users of research, the epidemiologic results or the data that we gather from these studies will make the practice of the medical profession better. However, the concept of the five-star physician has recently been altered, and now we have the concept of the six-star physician, wherein we have an additional role, that of being the navigators of the service delivery network. Prior to the COVID-19 pandemic and the enhanced community quarantine that was declared in our country way back in March 2020, this was the last formal face-to-face scientific conference that I attended. This was the Asia Pacific Medical Education Conference, which was held at Singapore last January 2020. And these were the delegates of the UERM MMCI College of Medicine during the said event. Now, it's important to share with you practical experiences or real experiences that we've had in the past when it comes to presentation of research papers, whether we're doing oral research presentation or poster presentation. So oral presentations at scientific conferences and symposia are generally formal. Thus, one should keep in mind that you are not presenting to novices on the subject, but rather to a group of very well-informed experts who are really interested in the new knowledge that they may potentially gain from your presentation. In the same vein, when we're talking of poster presentations at scientific fora, though they are generally less formal, less structured, they are still considered something that is of academic importance. One ought to remember that the audience remains the same, whether you're talking to experts in an oral forum or in just a poster presentation. Now, the fact that the audience is generally composed of well-informed experts should, however, never discourage any young or neophyte scientists to present at research fora, as most well-balanced good scientists of high stature will always use the opportunity at scientific conferences to positively criticize and build the self-esteem of young researchers rather than breaking them down. The very first time I presented in an international research forum, it was really nerve-wracking. And it's a bit different when you are just talking, let's say, to a group of medical students, because you are already confident because you're talking to technically someone of less experienced audience. But when we're talking to a scientific forum wherein you have experts in various fields of specialization or various fields of of endeavor, it's a bit intimidating at first. However, as you go through the process, if you keep on delivering your poster and your research presentations, eventually you gain some level of confidence, and the anxiety eventually is alleviated. So take it from me, from someone who has developed the confidence to present research over the last few years. It's not really as difficult as it may seem, but it is really intimidating at first. So science is much bigger than any scientist, and the value of solid, good scientific argumentation and facts will never be negotiable. So having that opportunity to have an academic discourse with experts, global experts, is something that is um it's an experience that you want to cherish, in the sense that it's not an opportunity given to all medical or health professionals for that matter. Now, normally, research presentations have the basic structure of scientific documentation, and very strict time limitations will regulate the extent of discussion of each of these subheadings. Now, the most important parts of any scientific presentation that is based on scientific research will basically be the results and the discussion of the results. Often you will notice that when we are dealing with the research presentation, we summarize or we truncate the entire scientific investigation into just five basic parts. You have the introduction, the methodology, you have the results, the analysis, and the discussion will be the bulk of the research paper or the research report. And when you are presenting in an international forum or in a scientific conference for that matter, the audience will often focus on the last three elements of your research paper. Now, how do you prepare for an oral presentation? Because the oral presentation is more intimidating, more nerve-wracking compared to a poster presentation. So first and foremost, ensure that the slide deck can effectively serve its purpose of being a visual aid. Meaning to say, the layout of your slides will also determine on how effective your presentation will be. In general, we would often tell our students, our trainees, that when you present, you should be familiar with the proper color schemes. In general, you always want to have a light background, and then your font should be able to stand out. So you use a dark font. Or it's the other way around. You can have a very dark background, but your font will be very light. The contrasting color schemes will make your presentation effective. We also want to minimize unnecessary animations. There are times wherein I have seen in international scientific conferences wherein, let's say, for example, the slide deck would have these GIF or those animations that would be, in my opinion, would be unnecessary. For example, you would have, I don't know, a cat that keeps on jumping on the side. It's not something that is relevant in a scientific presentation. So we would recommend you do away with such unnecessary animation. But animation, let's say, with the presentation of the words or the sentences that you want to project in your oral presentation could be effective. But I'm trying when I say minimize unnecessary animations, those that are really non-essential for your for the scientific thoughts. Or for example, images of your pets or of your loved ones coming being flashed on the screen. These are your unnecessary animation. Avoid use of irrelevant support materials. As I've said, sometimes there are speakers, they're very emphatic, they're very passionate about what they're saying. However, they interject, let's say, photos of their pets or of their family members or of their cars. Sometimes these are irrelevant. Sometimes the audience might misconstrue the addition of such images as an ostentatious display of one's wealth or whatever. So we try to minimize that as well whenever you come up with your oral presentation. It is also prudent that you try to practice the delivery of your oral presentation even before the date of the actual presentation. For some who may have difficulty with talking spontaneously, having a formal written script or reading from cue cards could be helpful during the actual presentation. This is something that is quite very particular for Filipino presenters, but not so for the non-English speaking experts. I've noticed that, for example, colleagues from other Asian countries that are non-English speaking, for example, when you hear Japanese presenters or your Chinese or your Korean presenters, some of them are not very fluent with English, and so sometimes there would be problems with their syntax and with their grammar. So for those people, for those nationalities, it is somewhat acceptable. However, for us Filipinos, who are very fluent with English, or who recognize English as the second most common medium of instruction in the country, you want to ensure that the grammar is consistently correct. As a grammar Nazi, I would prefer that there would be proper subject-verb agreement, appropriate use of tenses. For example, when do you use the past tense versus the present tense versus the future tense? Sometimes there would be differences with the way they use the plural forms of nouns. I would hear sometimes even the most seasoned researchers would commit grammatical errors. For example, some would say criterias, or for example, when we're talking of experimental trials, we would hear some researchers will say aquariums, when in fact there would be different plural forms for these particular nouns. So again, this is something that is more commonly encountered among Filipino presenters. We are quite particular with the grammar whenever we present in scientific fora or conferences, especially outside of the Philippines. Again, practice, practice, practice. Be sure you pronounce unfamiliar words, especially if there will be technical terms or medical jargon. So, for example, you might come across certain eponyms or certain syndromes that you are not familiar with the proper pronunciation of words. So, prior to your actual presentation, you might want to go over the proper pronunciation of words, and you can practice so that when you present, it will be more credible, it will be seamless, it will be very formal. Master the slide deck that you will be using, taking note of the correct sequence of slide animation, as well as transitioning if this is part and parcel of your oral presentation. There are times wherein you are given a podium, and the podium could be used as an aid when you deliver an oral presentation. Knowledge of the podium and the facilities in the lecture hall would enable the presenter to make use and control of all of these facilities in order to support the presentation optimally. If possible, view your slide presentation in a large room to see that colors project as they should. Sometimes there would be differences, let's say, with the machines that you are using. Let's say when you are using an LED projector versus an LCD projector, sometimes there will be subtle differences in these devices or this electronic equipment, and so you might want to do the technical preparation before your actual presentation. Use the speaker's preview room to see the formatting of the slide deck presentation did not change. This is particularly relevant when you're using, let's say, different computer units. For example, there are several instances wherein I work on, let's say, a document or a PowerPoint presentation and I use my MacBook. But once I transfer my files, let's say, to a Windows-based computer, sometimes the format or the layout or the font or the colors of the font change. And so sometimes it makes your presentation less effective because of let's say sudden changes with the format, the layout of the format, layout or the format. Sometimes even the animation doesn't work or the font of the slides are not the same. So these are things that you need to consider prior to your actual presentation. It is also wise that you have multiple copies of your slide presentation. Just to share with you my obsessive compulsiveness behavior, whenever I deliver a lecture, I would usually save my lecture slides in one USB drive, and then I would bring my external drive with me. I will also save it there, and then I will upload my work in my Google Drive. So in the event that there will be any technical glitch, whether I'm using my laptop or I'm using my flash drive or the external hard drive or my Google Drive, I would still have access to my slides in the event of any mishap or any sudden change with the actual computer that you will be using. Punctuality is also something that we have to be very careful about. For some reason, whenever we visit foreign countries, we tend to be more cautious about the time. When we say the bus will leave at 8:15, we make it a point that we are at the bus stand before 8:15 because the bus will come promptly at 8:15. Same thing, when you're presenting your research paper, the assumption is you will be quite punctual so that you will not be late for the actual event. If there is a need to save the slide deck in another computer, ensure that your presentation will be ready for viewing on your designated time slot. Respect the moderator's time cue. Sometimes when you are presenting on your side, whether you're looking at the audience or a technical panel or a crew member, sometimes they would raise signages, last 10 minutes, last 5 minutes, last minute. So they would raise these signages or their signs. And sometimes it's important that you take note of these so that if you are lagging behind their schedule, you could adjust the pace of your presentation to make it still effective while meeting the time constraints given to you. If possible, stay within the venue for the entire duration of the scientific conference or the research forum. I know sometimes when we go out of the country and you are presenting, there is this tendency wherein, for example, if my presentation is from 8:30 to 9:45, I will be at the venue from 7:30 until 10:30-ish, 11-ish. Afterwards, if there is nothing for me else, if there's nothing else for me to do, I would most probably get out of the scientific venue and be at local, just be a typical tourist and explore the country that I am visiting. However, that's a common thing for most junior presenters or neophyte researchers because you're still excited to explore the other countries that you are visiting. But once you get the opportunity to travel around the globe and you keep on going out of the country repeatedly, sometimes that behavior changes. But in general, if you are presenting, the rule of thumb is stay for the entire duration of the conference. Even if you're just presenting for an hour or two, if the conference is a 3-day conference, it's ideal that you stay for the 3-day conference and not just for the time slot of your presentation. And during that, you stay near the venue where you are to present. Now, wear the right clothing. There will be this is where you need to do, especially if you will be traveling outside of the country, you have to coordinate with the scientific or with the organizing committee or the scientific committee, and try to inquire what would be the appropriate attire for the event. Always present yourself in a professional manner wherein you are properly groomed at all times. Sometimes they would say, oh, you have to come in a formal attire. For women, many would wear your typical evening gown, or some would wear a modern day barot saya, or a modern day Filipino barong Tagalog. Or for the gentlemen, you can come up with your different Filipino barong Tagalog. And for me, when I present in other countries, I would often see if it's more of an Asian type of country, I would normally I would most probably wear my barong Tagalog if this were an Asian country. But sometimes if you're going, let's say, to the European nations or to the US or in other parts of the other continents, you might want to wear a blazer simply because of of the cold weather. Because if you're wearing barong, it's a bit, di ba manipis lang ang barong, the barong, the cloth of the barong is a bit um what's the word, not too thick. So sometimes the wearing of the coat would be more of a practical thing to give you warmth rather than a fashionista statement. But in general, you might want to just make sure that you are presenting yourself in a very professional manner. Or if this is like a local presentation, sometimes your regular white coat will be enough for you to be presentable when you are asked, or you are tasked to deliver an oral presentation or to have your poster presentation. So the attire is something that is also very important when you are presenting. Now, with regard to the art of communication, it is imperative that you are able to communicate effectively with your audience. You have to establish rapport using your nonverbal cues. Whenever you are talking to a group of individuals, let's say you're talking to an amphitheater or to a conference area or an auditorium, even though it's a big space, sometimes it's good that you establish eye contact with the people, let's say the first 5 rows of the gallery or wherever you are, because those are nonverbal cues that you are trying to establish rapport. You're trying to connect to your audience. So sometimes the way you look at people, or the way you look at the audience, or the way you nod, these are all examples of your nonverbal cues, which could be effective ways of establishing rapport. Things to take into consideration will be your self-image, your voice enhancement. Sometimes that not just the volume, but the timbre of your voice will also make it effective when you modulate your voice. There are instances wherein you want your voice to be heard very loudly, or sometimes it's effective that you whisper every so often. So again, the variation with the voice, with the volume of your voice, now is something that is going to make or break your presentation. The level of enthusiasm and zeal that you put in your presentation. Sometimes those effective pauses could really make or break the presentation as well. Even a bit of dramatizing can also uh, disrupt the monotony of a scientific presentation, especially when you were talking of molecular studies. I remember sitting down in one international conference which was held in Cebu, if I remember correctly. And we were talking about molecular genetics, molecular biology, and genomics. And there was this foreign speaker who was very frail looking, but I know he was an expert in the field of genetics. But he spoke in a very slow, soft voice. And it was so difficult to listen to him all throughout the presentation because the voice was husky. There was monotony with the voice. So it was very difficult to maintain and sustain the interest of the audience. So sometimes being dynamic in front of the audience would make or break your presentation as well. And never be apologetic during oral presentations. There are instances wherein maybe we are trying to be just humble. We will start, oh, I'm sorry, I'm not really an expert, or I'm sorry, I crammed for this presentation. Oh, I'm sorry, my slides are not as good looking as the others. Never do that. Do not dwell on the weaknesses of your presentation. But if you are very confident, you exude confidence with the way you talk, with the way you deliver, or the way you present your scientific data, that is something that is going to be very effective. Now, during the actual presentation, there are also a few general rules. For example, if the moderator has formally introduced you, and for whatever reason the research title has been read out loud already, there is no need for you to be like repetitive or echolalic that you will have to uh, utter once again the title of your research paper. Now, refrain from irritating manners or habits. Unless you're suffering, let's say, from Tourette's syndrome, wherein you don't have the ability to control the tics and the mannerisms. As much as possible, try to present your research in a very composed manner. Minimize the unnecessary gestures. For example, uh, I remember I had a batchmate. Whenever she would become anxious, she would have this nasty habit of rubbing her nose like this. And if you get to see her, she is already one of those esteemed allergologists in the Philippines. But the funny thing is, she is an allergologist, but her mannerism, and whenever she would talk in scientific conferences, she would unknowingly do that habit of, and it's funny because she's an allergologist, and that's like thing that is associated um um with allergic rhinitis. So there are things that we want you to refrain from doing, especially if you're going to have a 5 minute or a 7 minute presentation. Try to refrain from doing these unnecessary mannerisms because sometimes they would make the presentation less effective. Do not use excessive hand signs. Minimize moving around so much that it is disturbing. Sometimes, if there is no podium, you are given the liberty to walk around like a TEDx type of thing. But do not waltz around the stage as if you are dancing, because that is something that is also annoying at times. You can move about every so often, but take small steps, take small movements, not those excessive or those pronounced or your glaringly big movements if you are on stage. Avoid verbal graffiti. This is something that is very difficult to do. Even the most eloquent speakers sometimes would have these verbal graffitis. The ano nga ba yun? By the way, ano nga ba yun? Or um, sometimes we would have the repeated basically, basically, the mannerism or the repeated um words could be distracting. And so try to practice before your actual presentation. Sometimes it's good that you have a guide that you can just read or at least pretend to be reading whenever you're delivering the presentation, because that would make the oral discussion more fluid and more effective. I've mentioned about having cue cards, but of course we don't want you to read verbatim, especially in a monotonous voice, whatever is written on your slide deck or in your cue cards. I've seen even very competent clinicians who would come up with slides, and when they deliver lectures, they would just simply read whatever's written on their slide deck and give that lecture 15 minutes, and the next thing you know, when you move your head towards the audience, majority of the audience will already be dozed off, or will already be having your rapid eye movement type of sleep, because it is very monotonous and boring. So try to be as dynamic. I'm not saying that you should be comical, but you should more or less be animated when appropriate when you deliver your presentations. Speak clearly to deliver your message effectively across to the audience. If there is a need for you to highlight a particular word or a phrase in your slide deck, you might want to use a pointer or a laser pointer to highlight, especially to highlight salient points of your slide deck, especially if you have a busy slide, let's say a graph, that you want to explain the parts of a graph. As I've mentioned, sometimes there will be presenters who would use graphs, illustration, algorithms, flow charts in their presentation. It would be more effective if you're able to elaborate on these matters when you deliver your presentation. Stick to the designated time limitation. So whenever you are given the opportunity to present, if the organizers will say you are only given 7 minutes, do not exceed 7 minutes. I make it the point that whenever I have a presentation that is oral presentation, if the time given to me is 7 minutes, I make it the point that I have to finish my entire presentation by just 6 minutes and 30 seconds. I try to have a 30-second interval before the actual deadline or the actual end of my presentation, because I don't want to exceed the given designated time, especially when you are attending very big scientific fora. Let's say for a particular category, there could be 100 delegates presenting. So you don't want, imagine if all the 100 delegates did not observe the proper the time constraints. So imagine how how uh, chaotic the conference will be. A rule of thumb is that whenever you have a slide deck, each slide would correspond to about a minute of whatever you're going to say. And then, of course, you can add the title slide and the thank you slide at the end. But in general, so if you have 7 minutes of presentation, you should have a maximum of 9 slides. Then the first slide would be your title slide, and your ninth slide will be your uh, thank you slides. All the rest should be within that, should be limited to just about 1 second per slide. So that is a general recommendation. Now, I was mentioning earlier on how do you sustain the interest of your audience, especially if you're talking to a very big plenary. Let's say you are talking to 150 or 450 members of the audience. This is a typical graph of what the general public would have in terms of attention span. During the first few minutes of your talk, everyone's ears are glued to you. However, after, let's say, 3 minutes, 4 minutes have lapsed, the attention curve of your audience would gradually dwindle. And then once you are about to end, that's the time they would regain their interest in your paper. So sometimes when you hear the speaker say, in summary, then that's the time you wake up. Oh, it's summary, meaning to say it's almost the end of the presentation. So how do we address this? One of the things that we have mentioned whenever we would deliver lectures is that everyone would have what we call your first minute impression. So when you start, the mere the at the instance that you set foot on the stage, people are already looking at you. And so you want to establish the first impression that this is a person who commands respect and I should listen to this person. Now, this is the moment to make clear that you will share important information and signings that the audience cannot afford to miss. And if you want to get your message through, you should state it loud and clear in the beginning and repeat it at the end of the oral presentation. Now, the best approach, however, is to provide your presentation in several parts, each ended by an intermediate conclusion. So when you are delivering, let's say, a 2-hour lecture, let's say on, let's say, just looking at the science of let's say, of natural history of diabetes, it's going to be a very long, comprehensive discussion. And if you want to sustain the interest of the audience, you might want to develop subtopics or themes by breaking your entire lecture into smaller bits and pieces with intermediate conclusions. So, in essence, instead of that usual uh, average presentation, every time you would say, now, in conclusion, when it comes to, let's say, the diagnosis, then that's the time that the audience would, oh, because they hear the word in conclusion. And so you do this repeatedly. You have different themes. You break your presentation into several areas of salient points, and that's the time you continue to have you maintain or at least you sustain the interest of the audience listening to you. Now, with regard to the slide design and layout, titles should preferably be placed on the left rather in the middle because our eyes are accustomed to read from left to right. We try to use lowercase lettering because it is easier to read and they consume less space. And you want to put all the headings and text on the same height. Normally, when I prepare my slide, I make sure that all the font is the same from slide number 1 until the end of my last slide. I am consistent with the color combination. I am consistent with the font sizes or the justification, because these are subtle things that you can do to make your presentation more effective. Because when people, especially let's say you're doing a Zoom presentation, people literally just look at your slide deck. So if your slide deck is not as appealing or not visually aesthetic, it could make or break your presentation. It could influence the way the audience will perceive whatever you are talking about. Use the same font size for headings on different slides. In general, we use for heading a font size of 32, while for the rest of the text, it's about 24. If the text is too small, then it may be unreadable, especially for those people who are seated at the back, especially if the venue is not like an amphitheater wherein the rows are going up or slightly elevated. Ideally, the slide should be very visible even for people seated at the back of the conference room or the scientific hall. I was mentioning earlier on about colorblind individuals. One of my difficulties when I was a student, now when, for example, when teachers before when we were in grade school, I remember we have the blackboard. The blackboard is generally green, if I remember correctly, but I am colorblind. And sometimes my teachers would use red chalk. I can never read the red chalk on a green blackboard. It's very difficult. So if I am seated at the back, I cannot see whatever the teacher is writing on the board. So make sure that whenever you come up with a slide presentation, your visual aids, it should be not just aesthetically appealing, but it should be functionally be readable by all members of the audience. Use of font that is plain and will reflect clearly. Some of the more commonly used fonts for scientific and scientific presentations and research fora will be your Arial, your Tahoma, and your Kandara. With regard to the font size, we mentioned this earlier on, but in terms of the number of lines per slide, this is not a hard and fast rule, but a general rule of thumb is that you just limit the slides to just 5 lines. You limit the lines rather to just five lines per slide. As I've said, this is not something that is an absolute rule, but it's more of a recommendation. There are people who would say avoid using complete sentences. There are instances wherein I find the complete sentences more effective rather than just phrases or bullet points. When is this? If you're dealing, let's say, for example, with an asynchronous lecture, sometimes you rely on whatever is being presented already on the slide deck. So if the slide deck doesn't contain the complete thought, let's say the phrases don't have a subject and a predicate. If you read the slide deck, it might be difficult for you to really understand. Unlike if it's a complete thought or you write it in sentences, then it will be easier for the audience to really understand your slide deck. Use only one background color throughout the presentation. Make sure that the contrast between the background and the text color is good. Again, use dark colors on a light background or use light colors on a dark background. Preferably do not use red and green together. As I've said, as colorblind people will not be able to read the text or the font. Again, as a color green, colorblind person, as a red-green colorblind person, I would really appreciate that you use fonts that are contrasting, but not too that is still appealing and pleasant to the eyes. I also don't want the fonts that are the one that is like written in cursive. Sometimes the cursive font, it may look appealing at first, but if you are seated at the back, it might be difficult to read cursive writing. So these are some of the things that I would personally tell my students whenever you would come up with a presentation in the future. So right now, I'm hoping that the slide that I'm using is something that is, you will see that I'm trying to use dark font over a light background. If I want to use photos, I make it a point that the photos that I use as the back image or the background image of my slides, I usually use it at a transparent percentage so that it won't, you would see the contrasting colors of the background and of the actual font. Make use of pictures, graphs, flow charts rather than text and numbers to help tell the story. This is particularly true, let's say, in a research paper when you are presenting the methodology. Sometimes the methodology would be presented as an algorithm, so it's easier for the audience to follow rather than making them read paragraphs in your slide. Or sometimes the use of your pictures rather than elaborating, let's say, on how to, for example, how to use a centrifuge machine or a micropipette. If you have a picture of the micropipette and the centrifuge machine, it might be easier for the audience to appreciate what you're telling. Or I remember when I was doing a study before during my masteral program, we were tasked to explain how we dissect the mosquitoes. So the process of dissecting a mosquito because we were trying to look into the chance of variant transmission of dengue for these mosquitoes. If I put the methodology in narrative form, people might not people who have not been to a mosquito laboratory may not have a visual would not have a good grasp of what a dissecting microscope looks like, or what how would the mosquito look under the microscope. So having actual pictures could also be effective at times, depending on what you are trying to convey to your audience. If appropriate and necessary, show data numbers prominently, and framing of graphs is not generally recommended, as too many lines. Too many lines are sometimes deemed confusing. Include the slide with an appropriate picture or graph for every fifth slide. Now, with regard to slide presentation, there are people who would time the transition of their presentation because they want to be careful with the time constraints given to them. However, this could be a double-edged thing in the sense that there would be possibility of having technical glitches. So beware of setting a fixed time for each slide to transition automatically throughout the presentation proper, because if there will be a technical glitch, then this could lead to problems with your presentation. Now, with regard to poster presentation, so we're done with the oral presentation. I've given you practical tips on how to deliver an effective oral presentation, from the actual delivery or the conduct of speaking, your demeanor, your physical appearance, your slide deck. Now let's go to your posters. So scientific posters normally contain the same structural layout that one will find with any scientific document. So in general, important facts should be considered when planning a research poster. The selection of information to be included in the poster, because remember, a research poster is like a capsule or a truncated version of your actual research paper. As to what data or what information or how much of the information you want to present in your poster presentation, then these are some of the things that you must factor in when you come up with the layout of your poster. There should be organization of the contents. You try the integration of the visual elements, creation of the focus points. Sometimes it's prudent that you also establish correct relationships of elements and make sure that the poster is visually acceptable, and it's something that is very pleasant for the general public. So a poster presentation should basically include the formal scientific part on the poster itself, and while you are presenting, you should discuss and present your data in a relaxed scientific manner. So again, when you go to other countries, or in even in local scientific fora, sometimes the organizing committees would use digital posters. So, for example, the very first time I used a digital poster was when I presented at the Hong Kong University, at the Li Ka-shing Faculty of Medicine and Surgery. And this is a typical LED projector. There were about 100 LED projectors in Hong Kong. And that was the first time I presented a digital poster in a scientific conference. Others would be your typical old school. Um, for example, this one in Korea. The last time, I haven't been to Korea. I want to visit Korea again. So I haven't been to Korea for since 2019, and I wanted to share a funny story, a funny and somewhat irritating story um that happened to me when I was in Korea. So this is the poster presentation in Korea was the typical tarpaulin poster. But I already predicted that I would need materials for me to put up my poster. So imagine the poster is a very bulky thing, and and So my story is this. So I had this very bulky poster, and I didn't want to have it checked in the plane because I was afraid what if it gets misplaced. So I opted to hand carry this large tarpaulin. So this tarpaulin is massive. As you can see, it's even taller than me. And so it's a very big tarpaulin. And then in my bag, I made sure that I would bring your masking tape, scissors for me to use when I would as I was going to present this poster presentation in Korea at the World Federation for Medical Education. I was the lone UERM delegate sent to this conference in I represented technically the UERM for the World Federation for Medical Education way back in 2019. And one of my colleagues from UP PGH, actually, she was my mentor. She was also presenting another research paper. But the funny thing is, she did not put her masking tape, her scissors in her check in luggage. And she placed it in her hand carry luggage. And, at the airport, people thought those were going to be used for an improvised explosive device. And so she was stalled at the immigration of Korea of Seoul because people thought that for some reason, so they had to confiscate her packing tape, her scissors, everything, yung straw na tali kasi nga akala gagawa ng improvised explosive device. So what's my take home message? If you're bringing packing tape, straws, string yung tali na straw, scissors, make sure you put it in your check-in luggage because you don't want to be stopped at the Bureau of Immigrations thinking that it could be used for whatever terrorism activity. So just as funny anecdote with regard to this poster presentation. So as you can see, I use my own tape to put up my poster. So like a Boy Scout, laging handa. So this is something that you might want to consider also when you present in an international forum using your regular poster, your regular tarpaulin poster. Now, with regard to poster presentation, there are also certain guidelines. First, the title is important as it catches the eye first. I know that for most of you, you have very long titles because that's the academic way of doing it. We want you to put the PEOM, the population exposure outcome methodology, in your research title. But when you attend international research fora and scientific conferences, you will notice that they want to make the titles very catchy and short. So for example, meron dyan, um, for example, the Big Bang of COVID, something like that, something that would be very catchy. So the title is something that is important because if you are to come up with a poster presentation, sometimes audience would just read the titles first. So there are scientific conferences wherein they want a catchy title, but there are scientific conferences that want the long academic title. So whatever is being asked of you, make sure you comply. If they want a short title, give them a short title. If they want the long academic title, give them the long academic title. Play around with the layout until the layout of the poster pleases your eye. There is no incorrect layout, and a poster with a background will attract more attention than a plain one. Just make sure that the background is not overpowering. Do not simply make an enlargement of your abstract that was submitted. There is a common mistake for neophyte researchers. They just sometimes when you attend research conferences, they would first ask for the abstracts. So if the abstract has been chosen for inclusion in a poster presentation, some neophyte researchers would just use the same abstract. No, don't use that. Sometimes you can improve on whatever you put on the poster, because sometimes if it's especially if it is a contest, your there would be judges, a panel of judges who would sometimes go around the venue and they would actually read your poster. So if you just submitted a very truncated abstract, you might lose the interest of your audience. But if you come up with a poster that is brief, concise, and yet complete, it would be to your advantage. Avoid cramming the research poster with too much text, as well as figures and tables. Check that there are no spelling mistakes or grammatical errors, just like in your oral presentation. See to it that you put up your poster and keep it on display for the scheduled duration. So let's say if the poster presentation, if the research poster is if the research poster presentation will be from, let's say, 3 in the afternoon until 5, make sure that the poster is up, let's say, as early as 12 noon, so that or if possible at the very start of the day, so that people can see your poster throughout the duration of the conference. Now, sometimes it is also prudent that you stand by your poster. You literally stand beside your poster. So in the event that judges would visit your poster, if they have questions, you're on the spot to answer any inquiry. This is very common for WONCA. WONCA is the International Organization for Family Physicians. It's customary for us whenever we present at WONCA to stand beside our posters, in the event that there will be judges who will be visiting the booth or the poster for any clarificatory question. If for whatever reason you decide not to attend the conference, please have the decency and the etiquette to withdraw your poster in a timely manner. Now let's move on to your actual research forum, which will, correct me if I'm wrong, this is tentatively scheduled by November of 2023. So I will not preempt whatever Dr. Wanko will say with regard to the orientation, but in the past, when we have our oral presentations, we would just limit the number of slides to the following. So one slide for the title, for the introduction significance, for the objectives. If it's an analytical study design, you can have your hypothesis and methodology. 1 to 3 slides for the data and results, another 3 to 4 for the discussion, then conclusion, limitations and recommendations, and the references. But again, these are just suggested parts of your oral presentation. Dr. Wanko might give a different format, so we will just comply with whatever the department will prescribe when it comes to the slide deck or the the oral presentation. Now, for purposes of the research poster, it is my understanding that you need to have an actual printout of your poster, which will be 3 feet by 5 feet in dimension. And what will be the content of their poster? It will be the following. But again, as I've said, I will not preempt if Dr. Wanko would want to have a different format. Then it will be the discretion of our department chair, and we will just comply with whatever he will prescribe or recommend. Now, last few slides, 10 rules for effective presentation. Always talk to the audience. The presenter should know the level of the audience he or she is talking to during the scientific conference or forum. It's different when you're talking to to a group of health experts or medical experts versus if you're talking to the lay. I've been asked sometimes to present research papers, let's say to press people. So the level of understanding of your of your audience would also vary. And so make sure that you know who you are talking to. So if you're talking to a group of experts, health experts, then by all means use all the medical jargon that you can think of. But if you are relaying the results of your study, let's say to allied health professionals or to non-medical people, you might want to refrain from using technical terms or try to explain things in a language that would be comprehensible to the level of knowledge of your audience. If the presenter says too much, the main message may be lost, and so at times less is more. Only talk when you have something to say. If you only have preliminary data, do not put in an abstract for an oral presentation, but rather opt for a poster. So sometimes your interim reports could already be presented as a poster, but not for oral presentation. Be sure you have a substantial amount of data that may be viewed as meaningful. Work that has been recently published or is submitted for publication is usually a good choice for discussion. Make the take-home message pertinent. If you were to ask someone a week later about what you presented, he or she should remember 3 points. In the event that they are not able to verbalize the key points, then your emphasis was wrong. Be logical. There should be a flow throughout the talk. And normally the beginning or the introduction is to set the stage. The story or the results in the discussion will be given in the middle, while the conclusion, the recommendations will be given at the end, and this will be the big finish with the take-home message. Now, treat the floor as a stage. As I've said, sometimes it's difficult if you are talking to a big audience and there is no podium in front of you. Sometimes the podium could serve as to keep you calm or to keep you composed. But if there is no podium, make sure you have the ability to use the stage for you to talk off or when you deliver your presentation. Practice and time your presentation. Do not go off on a tangent. Visual cues should be used to help. The more presentations you give, eventually the better you will get. Use visuals sparingly but effectively. Visuals should support whatever you are discussing. Review your audio and the videos of your presentation. Sometimes there will be videos embedded in the presentation. Please make sure you view it prior to your actual presentation to if there will be any technical glitch. And provide appropriate acknowledgements. Sometimes you can use institutional logos if this is especially if you're being sponsored by your institution, you might want to include the institutional logo and the name of your institution, a sign of acknowledgement to where you belong to or to where you are affiliated with. Now, so I have given the basic tips on how to deliver oral and poster presentations. I wanted to give you like a pep talk as to what is the quality of student research papers that we have produced over the past 2 decades. I returned to the UERN College of Medicine as a young faculty member in 2007, a few months right after I graduated from residency training from the UP Philippine General Hospital. So I remember getting an appointment in the College of Medicine as of April 2007. And if you will recall, your research paper is completed in 2 years. And so I want to share with you my experience as a faculty in guiding students come up with their research. And I want to share with you how much we have seen our research papers of our students how it has changed not over the few years that I've been with the Department of Preventive and Community Medicine, as to how it has shaped or how it has gained its reputation as a powerhouse, as a force to as a force to as a force of academic excellence, that people are recognizing that we are producing quality research year in and year out. So I want to share with you, since 2007, there has never been a year wherein my student research papers have gained recognition for the medical center, whether in local or in international research fora. And I want that tradition, or that that uh tradition of academic excellence to persist now with your batch. So I returned to URM in 2007, and one of the very first few papers that I did with my students is this paper, a quasi-experimental trial on the effectiveness of public health lectures on reproductive health and increasing the knowledge, attitude, and practice regarding contraception use among heterosexual couples in Barangay San Isidro and De La Paz, Antipolo City. And this paper won for the very first time, as I was a young junior consultant, and this paper won first place in the Research Institute for Health Sciences Research Forum in December 2008. And to be modest about it, no, actually the first, the second, and the third place were all my research groups, and I dominated the research contests at that time. And it was the very first time that we sent this paper for international presentation. So this paper was accepted for poster presentation in WONCA Asia Pacific, at the WONCA Asia Pacific Convention, which was held in Hong Kong. So remember, back then, hindi pa naman common yung mga umalabas ng, usually Southeast Asia lang ang napupuntahan ng mga medical students. And WONCA is the International Organization of Family Physicians. And as you all know, whenever you have whenever you have presentations outside of the UERM, the RIHS subsidizes the presentation, or the expenses to be incurred. If it's a poster presentation, RIHS will cover 50% of all the total expenses. If it's an oral presentation, the RIHS covers 100% of all expenses. And normally this is only for one student, not for the faculty, but only for the students. One student representative. And we were so excited, and we wanted to fly to Hong Kong. Unfortunately, we requested for the budget, and we were about to fly to Hong Kong, but the SARS epidemic happened. And of course, we were discouraged by the administration to go to Hong Kong simply because there was SARS in China and in Hong Kong back then. But this was the very first paper that was ever accepted in the WONCA Asia Pacific Convention coming from UERM. Now, the following year, this is another paper under my student group. This is a single-blind randomized controlled trial on the effectiveness of ginkgo biloba in increasing immediate and delayed memory index scores of healthy UERM medical students using the repeated battery for the assessment of neuropsychological status, or the RBANS. Again, this paper was cited as a second place in the Research Institute for Health Sciences Research Forum, but it was also the first time that we sent papers to the Philippine Society of Experimental and Clinical Pharmacology, and we won first place for the very first time for that particular year. And the thing about this paper, the student mentee that I had is Dr. Frances Gail M. Toralba, and she is now a consultant, no, at the Department of Medicine of UERM. And working with her again way back in 2021 at the peak of the COVID-19 pandemic, it was such an interesting experience that to see former students becoming colleagues in the College of Medicine, co-faculty members, and we discuss about the research paper. She's actually a nutrition expert, no? Uh, and until this day, she was telling me of how significant the paper was in her current practice as an internist nutritionist dietitian. Then the following year, this is another paper of my group, a cross-sectional study on the relation of family function and malnutrition of children aged 5 to 10 years in Sitio, UERM, Barangay Sumulong, Antipolo City. Again, this was presented in WONCA, in another WONCA Asia Pacific Conference. It's an international conference, but WONCA celebrates every 2 years. So in 2009, it was in Hong Kong. In 2011, it's again an international conference, but it was held in waterfront Cebu, no? So it's still an international conference, and we were still part of WONCA. And this is now our students. These were my students back then. If you're familiar with Dr. Angela Russell Chua, Dr. Chua is one of our consultants now at the section of urology, Department of Surgery. And again, seeing Dr. Chua being my colleague now in the College of Medicine and looking at the paper they did almost almost a decade ago, it's really such it's really what's the word, nostalgic feeling, no, to see your students now becoming your colleagues, and they appreciating research. Now, this is another student group of mine, validation of group-based anger management program and institutionalized Filipino children in conflict with the law using an experimental time series design. And this paper was accepted for presentation in another international congress, in particular, the International Society for the Prevention of Child Abuse and Neglect in Nagoya, Japan. So, as you can see, in just a matter of several years, we've been sending our students to international research fora, not just in the Asia Pacific, Southeast Asian region, but in other Asia Pacific countries, Asian countries, now in particular in Japan. Again, this is my student research group. Now, this is also another paper which I co-authored, a randomized controlled trial on the effectiveness of baking soda acetic acid solution as adjunct to benzoyl peroxide in the treatment of acne vulgaris. This paper won first place in the APMC Annual Convention, Western Visayas State University, in February 2013. And to be honest, the second place for that particular competition also came from UERM. But just wanted to show you that these are my student groups. Some of these are also consultants now in the UERM. If you are familiar with Dr. Jonathan Lee from the Department of Pediatrics, he was also my research student and now a colleague in the faculty of the College of Medicine. And then another paper, this is not my group, the randomized control trial on the effect of pre-circumcision gum chewing on the level of post-operative anxiety among school-aged boys in Quezon City. This is not officially my research group, but I help the actual faculty mentor guide the students because it was on a clinical study, and the faculty was not the clinician at that time. So this paper was the very first paper that we sent to the International Student Congress of Biomedical Sciences at the University Medical Center Groningen, the Netherlands. So as you can see, we are already sending our papers, our student papers, to European conferences. And notice that it also won another APMC event. So we've been since it started with the paper from uh the one from Iloilo. Then you can see over the years we have established how we have become a force to reckon with when it comes to research output of students. And so the APMC was slowly recognizing us that research of medical students coming from UERM College of Medicine were of a different caliber compared to other medical schools. So the paper was actually the research group of Dr. Georgina T. Paredes. I'm not sure if you know her. Dr. Georgina T. Paredes is a former dean of the College of Medicine and the lone professor emeritus of the College of Medicine in community medicine. And this is the late Fernando S. Sanchez Jr., the lone dean emeritus of the College of Medicine and the former chair of the Department of Preventive and Community Medicine. So they are both former chairs of preventive and community medicine. So this was taken several years ago. And these were the students under Dr. Paredes and myself, no, when we sent our students to the ISCOMs in 2014. So this is almost a decade ago. Then the following year, this was a cross-sectional study on the biopsychosocial factors positively influencing the quality of life of persons with disabilities who consulted at the UERM MMCI. This was my paper. It was the only one that was recognized by the RIHS that year as one of the finalists for the poster presentation. Then another paper of mine, this is the comparison of family functionality and quality of life of families in association to applied behavioral analysis versus standard of care of children with autism spectrum disorder in a case control study. This paper was also another finalist at the ISCOMs in the Netherlands. So again, I am very proud of this research group. These are my mentees under that particular for those 2 years for research methods 2, research projects 1 and 2. Now, another paper, Association of Repetitive Movements and Carpal Tunnel Syndrome among grocery workers in Cainta, Rizal. This paper won second place at the PAFP, or the Philippine Academy of Family Physicians annual convention. And again, just to highlight how we are also penetrated the Philippine Academy of Family Physicians when it comes to student researches. Again, just showing to you our students during that conference. Another paper of mine, a cross-sectional study on the biopsychosocial factors influencing quality of life and adherence to treatment of people living with HIV. So this was also nominated as a finalist, was recognized as a finalist for the RIHS Research Forum. Then this is another paper, the effects of probiotics as an adjunct treatment to decreasing the fasting blood glucose. Filipino employees of UERM in a quasi-experimental trial. This was also one of the poster presentation finalists, this time at the Philippine Association of Academic Biochemists. So as you can see, over the years, we have started to join different academic societies from PAFP, PSECP, now APMC, then of course, the Association of Academic Biochemists. Then this is another paper, the effect of action video games versus non-action video games on cognition in geriatric adults. This is my mentees again. And this paper won for the very first time in the poster presentation, in particular the geriatrics category in ISCOM. So again, This is these are our students who went to the Netherlands that time, and they won the category for the geriatric category. Again, this is my mentee. These are my mentees, and I'm very proud of them. Another paper, Association of Laughter Yoga in Improving the Quality of Life of Geriatric Patients Residing in a Nursing Home. This was once again presented in an international research forum, but the international research forum was held at the Manila Hotel. This was conducted by the Metro Manila Health Development and Research Consortium. And again, just to show you the students who participated in this forum, and we won second place once again. Again, these are my students. I'm very proud of my students who competed in this competition. This is again my research group, Association of Permissive Parenting Style and High-Risk Behavior Among Undergraduate College Students, an analytical cross-sectional study. This paper was once again accepted at the ISCOMS. So as you can see, I've been sending UERM students to ISCOMS for several years, but unfortunately, this was at the peak of the COVID-19 pandemic, so we couldn't send our students to the Netherlands during that time, but the paper was eventually published at the RAH's journal, and again, I am still very proud of my research group. The following year, this is again part of the pandemic years, an analytical cross-sectional study on the relationship of perceived social connectedness and burnt out symptoms in medical students from a private tertiary institution in Metro Manila enrolled in an online curriculum for academic year 2020 to 2022. So again, this was at the peak of the COVID-19 pandemic. We couldn't go to other parts of the globe, and we were so happy that we were accepted and we won at the International Medical Student Research Conference. This is the first time UERM participated at the Phramongkut Klao College of Medicine conference in Bangkok, Thailand. This was the very first time UERM joined, and we won first place. We were supposed to fly to Bangkok in December 2021, thinking that it was already safe to travel, but Omicron happened, and so once again, President Garcia said it's safer not to send our students, so our students had to compete online, but nonetheless, we brought home the bacon and we won first place in this International Medical Student Research Conference. Now, the following year, same batch, association between cultural health beliefs and health-seeking behaviors with quality of life across generation among adult Filipinos in the National Capital Region, an analytical cross-sectional study. This was once again accepted for poster presentation at the Groningen, but again, this was still at the peak of the COVID-19 pandemic, and so we couldn't send our students to the Netherlands. So again, but I'm very proud of my research group. As I've said, no, year in, year out, I've been sending at least one of my student group to ISCOMS. In fact, for the past 5 years, it's mostly my student groups who have been successfully been accepted at the ISCOMS, no, for the past 5 years or so. Now, this is another paper, but this is the group of Dr. Wangko. This group of students were able to present still at the Phramongkut Klao College of Medicine in Bangkok. This was after several years of non-participation in face-to-face conferences. This was the first time we once again sent our students overseas. So the group of Dr. Wangko went to Thailand and they won first runner-up. So they were the silver medal award. The previous year, we were the gold medal awardee, but for this year, for 2022, just last year, we were first runner-up. So we're hoping come December 2023, one of your student papers will also bring home the bacon If you want to participate in the International Medical Student Research Conference being conducted by the Phramongkut Klao College of Medicine in Bangkok, Thailand. Now that same year, the only participants who were able to join the ISCOMs, this is again my student research group, Association of Screen Media Exposure and Burnout Among Adolescents Enrolled in Different Online Curricula in Metro Manila. This is considered a winner. This is the student, he currently clinical clerk Jay Pukan. So he went to the Groningen, the Netherlands, to present, and he won the category under psychiatry. Now, this same paper not just competed, so Jay was very fortunate because within that same week that he was in the Netherlands, the very same paper was also accepted at the Wonka Europe conference that was held in Brussels, Belgium. And so Jay was able to attend two different research conferences in a span of 1 week, one in the Netherlands and another in Belgium. And the very same paper has been accepted. So this is the Wonka Europe Conference, but it is also for presentation at the Wonka World Conference, this time in Sydney, Australia, next month. But I'm not sure if we will still be able to participate because Mr. Pukan already went to the Netherlands and Belgium, and so there is no more subsidy for his trip to Australia. So bottom line is, over the last 2 decades, in particular for my groups, I have seen my groups blossom into the neophyte researchers, and I am very positive someone in your batch is going to also bring honor and prestige to the medical center. Sort of pressure siguro dun sa grupo ko, no? Kasi as I've said, no, since 2007, I haven't had a year wherein one of my students' research papers didn't win any citation or recognition either in local or international research fora. The general idea is this: when we walk the talk, when we say we want to produce 5-star physicians, and we talk of research as an integral element of being a 5-star physician, we really mean that. And that is why if you feel your faculty members are being very difficult when it comes to research, it is simply because you have seen the quality of research that we have produced over the last 2 decades. When we're talking of the PAASCO accreditation, accreditors look into the quality of research papers that our students produce. And these are all testaments on the caliber and the quality of research papers that we come up with in the Department of Preventive and Community Medicine of the College of Medicine of UERM. So just again, cite just proof that we were accepted at the Wonka, both for the Wonka World and the Wonka Europe Conference. Now, aside from presentation, the general rule is we also want your papers to be published. That is why we're very particular when we say, please revise your paper accordingly. It is because we want your papers to be published. If your papers will be published, it's going to be a laurel on your head when you come up with your curriculum vitae, because it's going to it's not all students can have that distinction of having a published research during medical school. So there is an opportunity for you to have your papers not just presented, but even published. And our journal, the Health Sciences Journal of the Research Institute for Health Sciences, this can be accessed by other people all over the world because it has international coding system. If you check HERDIN is the database, the local database of the Philippine Council for Health Research and Development of the Department of Science and Technology. You can actually access the RIHS Health Sciences Journal. So even if, let's say, you are in Mindanao or in the Visayan region, you can have access to our student research papers that are being published by the RIHS. And that's why I want you to really work hard on drafting your manuscripts, because from presentation, you can now go to publication. Dagdag prestige pa if your publications are cited by future investigators or future researchers. And that's what we want to have when we say you become not just the doers of research, but sometimes doctors become the end users of your research. Just to prove to you, or at least just to show you that we do walk, we're not just talking of these. No, if you look at the roster of publications of your faculty members, in particular in the Department of Preventive and Community Medicine, you would see that most of your senior faculty members in the department have numerous publications, not just in local papers, but even in international journals, such as this one, the Journal of the Endocrine Society, or the European Journal of Internal Medicine. So we do have papers that are published in other medical journals. And as I've said, this also improves on the credentials of your faculty members and of the students. But the thing is, sometimes if you keep on doing research, if you become very good with presenting data, you become good in doing poster presentation, you become good in oral presentation, you become recognized by other people outside of the health professions. So sometimes, because of research, I have been personally invited to various for various speaking engagements. If the COVID-19 didn't happen, this was my short-lived career with the Kapuso Network. So I was supposedly invited to be sort of a regular in DZBB Super Kalusugan. So I started my stint as a regular speaker or guest or resource speaker for DZBB in December 2019. But the COVID-19 happened, so the program was cut short in January. But still, it's something that it was worth the experience. No? At least having your foot inside the door of, something bigger, is something that I will forever cherish. No? Getting to see some of the personalities when it comes to local news and public affairs, it's something that I will forever cherish. Or during at the height of the pandemic, I've been invited to speak not just in local, but sometimes in even international scientific teleconferences. And sitting literally with Edsel Salvania. Edsel Salvania is actually a batch higher than me at the Institute of Biology in UP Diliman. Edsel is a very brilliant doctor. Getting to sit down with Edsel and pick on his brain when we were talking about COVID-19 back then. We were talking to not just local audiences, but even to people in the United Kingdom. I'm not sure if you know Mr. James Deacon and Mr. Eric Santos, but I was told they are celebrity people in the local show business. And getting that opportunity to again work with people outside of the medical field is a testament of how people view you as a credible content expert or a resource speaker because of research, because of your ability to communicate, or because of your ability to synthesize data and share it with the lay people. It becomes to your advantage. Of course, as a doctor, I've also had the opportunity to work with many pharmaceutical companies. Now, I've been, truth be told, one of my bread and butter as a doctor is I speak for many pharmaceutical companies, because perhaps of my credentials as one of the youngest professors of the College of Medicine, and of course my expertise or my training in family medicine, tropical medicine, and diabetology. Perhaps people even in the other industries started to recognize my contributions in primary care, and so people start getting you to talk to bigger populations or bigger people. So these are some of the things that I've been doing during the pandemic. So daming mga webinars that you get to participate in. Part of your outcomes of your delivering your research or becoming a good speaker for presenting data. Not just with the parang na ano na ako no na except for the TV. I've been in the radio, I've been with the in the internet, now even with the news, no news. So people get to interview you, no, and they talk about epidemiology, they talk about you're asked about epidemiology, you're asked about your opinions, your viewpoints on certain current problems of the country, and you talk about all of these. I guess it's not every day that you get the opportunity to share your knowledge with people. And again, why do they get interested in you? It's because of your perhaps eloquence, or because of your ability to make complex ideas from research into chunks of information that would be easily be digested by the general public or the lay people. And this is the importance of talking about research. You're going beyond, you're putting research into the practical application of things. And just recently, just to share with you, again, uh, getting the opportunity to talk to non-medical people, no press conference, you're being called to attend press conferences, sharing the seat, no, with again with our Vice President for Research, Dr. Jennifer Niles, with our DOH Special Advisor, Public Health Advocate, Dr. Tony Liachon, and Dr. Obet Salvino. Uh, Again, why are people interested with what you have to say? Because you've done research, you've done epidemiologic investigations that could change the way we practice medicine in the country, or the way we contribute to the health of the nation. Again, it's beyond the research fora. So, what have we discussed today? When presenting research, whether oral or in poster form, the main task at hand are to answer questions and provide further details, and to convince your colleagues that what you have done is technically sound and relevant. In an oral presentation, the speaker has more control over what the audience can focus on. And as the speaker proceeds to an oral presentation, he or she can tell a story and lead his and her audience along particular paths of reasoning and thought. With the poster presentation, the audience is free to key in on specific points that they may be particularly interested in, and the material presented in poster form must convey the essence of the research undertaking. A research poster is simply a static visual medium that the researcher can use to communicate his or her ideas and messages. As lifelong learners, doctors are expected to hone not only our critical thinking capabilities, but likewise our communication skills. Physicians must have the burning passion for new learning, which may be acquired from academic discussions during research fora and scientific conferences. These are some of the references that I use for my presentation today. If you're interested to do supplemental reading or if you want to do independent study, you might access these from the World Wide Web. I believe this is my last slide, and in the next few weeks, we will be listening to your presentations. I hope by now you have already completed your data collection. You are in the process, I hope, of data analysis already. You are drafting your research manuscript, because in a couple of weeks we will be listening to your presentations, and we wish you the very best. Good luck, future medical frontliners, and I'm hoping one of you, or at least several of you, will continue on the legacy of bringing prestige and honor to the College of Medicine through your research outputs. And hopefully, you get to present your research paper not just in UERM, but also throughout the Philippines and in other global international stages. With that, thank you and have a good day to everyone.